Let's talk a little bit about spinal disc conditions. Now, first of all, the spinal disc is the little cushy material in between the vertebrae. You have a disc between every single vertebra in your spine all the way down to the L5-S1 in the sacrum area of your lower back, but you don't have a disc between your skull and C1 nor between C1 and C2, and that's a good thing because you need all this motion. You can't have a thick cushy disc interfering with range of motion. But the disc basically serves two purposes. Number one, it acts as a shock absorber where you're walking and running around in gravity. And the other thing is it acts as a spacer in order to allow the nerve to get out to that part of the body. But with slips and falls and irritation and even the aging process, these discs can gradually wear out and lead to very, very serious conditions. So let's talk about a normal disc. Here in this case, you got the outer margin of the disc, and then on the inside you have all of these cartilaginous rings, kind of like the rings if you chop down a tree, you'd see a bunch of rings on a tree. And in the middle, you have something called the Nucleus Pulposus. It's a very, very dense marble-like center of the disc, and its main job is to simply attract water into the disc. A healthy disc is about 90% water, and a fully thin or absent disc is of course 0% water, and there's everything else in between. Now, sometimes when I see MRI reports, I'll see multi-level desiccation or desiccated discs. What is that? Well, that is when the annular fibers that hold the water in towards the nucleus of the disc begin to crack for whatever reason. This can happen as part of the aging process, but it can also happen as a result of trauma. So the annular fibers that hold the water in the disc begin to crack, and we call that desiccation or a desiccated disc. The next level is a disc bulge. There's some confusion between what a disc bulge is and what a disc herniation is, so let me explain. Let's assume that the nucleus has stayed in the middle of the disc. We're now going to take a 90-degree, almost like a baseball diamond, and we're going to draw out to the margin of the disc. And you can see this bulging material going out beyond the rest of the contour of the disc. And since it's wider than 90 degrees relative to the center of the disc, this is considered a bulge. Okay, so it comes from here and it goes all the way over to there. You can see that margin is disrupted. And this is actually more stable than a herniation. Now, if there's an aggravating factor, if there's some kind of advanced degeneration or arthritis or some other complication with the spine, then this could be a more serious problem. But generally for people, when there's just a bulge and the nucleus hasn't migrated out to the side at all, then this is generally a stable type of a problem. However, when you have a herniation of the disc material, it's now definitely, that nucleus has definitely left the center of the disc, and it's now going out towards the outer margin. Sometimes it goes all the way out here. We call that a sequestered disc, or a sequestered nucleus in this case. But here you can see this is much less than 90 degrees, and it's in one spot. And this can cause extreme pain, and oftentimes, unfortunately, this will definitely need surgery. And sometimes it won't even respond well to the laser type of surgery, which is generally less invasive than the fusion surgery, where they get out the hardware and it's a rather extensive rehab process. So we never want to see that. We can usually help people that are in this range right here. We don't want to get you here. You got to drink enough water and you got to make sure that your spine is moving properly so that your spine, your discs, can passively absorb the extra water that's in your body from having drank enough water, and that will help to prevent the desiccation as a result of the aging process and get you over here as much as we possibly can. Do you have any questions about this or any of our other videos? You just email me back and let me know.